Okay. So, welcome to Compassionate Action, the Georgia Medical Cannabis Society, and today we have Dr. Felicia Dawson with us today. How are you today?
I'm great. Thank you for having me.
You're welcome. You're welcome. And so, Dr. Dawson is a leader in holistic gynecology and a staunch advocate for medical cannabis. She's been over 30 years in practice. Wonderful. And experience in holistic obstetrics and gynecology, and is a respected educator and consultant in integrative and functional medicine. Welcome, Dr. Dawson.
Thank you.
I have some questions for you, though. Kind of tell us about your journey with traditional obstetrics and gynecology and focusing on holistic.
Well, when I first got out of residency, I joined another physician who was in practice, and we were doing conventional obstetrics and gynecology. But after a couple of years of me practicing, I found that people were coming back with some of the same things over and over again. Like I quickly learned that surgery and medicine is not the only two things to help. So I started looking for other alternatives, and I found the American Medical Association and started thinking about holistic medicine. And from there, I went to functional medicine, which is even more evidence-based science. And as time went on, with liability, electronic medical records, lowering reimbursement, a lot of political stuff, it just wasn't getting as much fun. The business of medicine was starting to wear on me and keep me awake at night. And I just, as I was starting to think about what else can I do, I saw Sergeant talking through his weed documentary, and I learned that cannabis was medicine, and I was not taught that. So I became fascinated with that, and from there, I started learning more and more and more, and eventually came to my practice in 2016, and I've been working in Georgia, being a cannabis advocate and educator ever since. Recently, I actually did a presentation on ran rounds at the Department of Obstetrics and Gynecology at Morehouse School of Medicine, trying to teach the residents and attending physicians there that the research we have on cannabis and pregnancy research is not as good as we think. I'm really about trying to educate the lay public, our legislators and physicians and healthcare providers in general about cannabis.
And that's good. Education is truly needed, especially looking at our legislators been making these laws based upon the limited information that they actually know. And we definitely need to make sure that they get more information so they can make more informed decisions. And get themselves to talk to them. So basically kind of touched on what inspired you to advocate for medical cannabis when it comes to but how do you incorporate cannabis into your holistic health?
My personal, well, I do use. There's only one brand that I have on my website. It's developed by Dr. Weston, leading educator, physician, innovator in the field. He has organic, hemp-derived I use every day. I've been in everyday meditation. I exercise every morning. Walking, I eat organically as much as I can, spiritual practice, and just trying to have fun. In nature. I love the arts. Visual arts. How I stay.
So are you still seeing patients from the closure? You're active
online consultation.
And with some of the patients that you've had, we've seen like results. Some of them give you some feedback.
Because most people that I've seen have anxiety, depression, or breast cancer. I've interviewed people who want to try CBD or medical cannabis. And so I look at the whole picture, how they moving, do they enjoy their job, do they have a strong support system. I look at their whole picture and see how CBD and cannabis can fit into our picture. I look at any drug or interactions.
That's good. That's really good. So you're basically able to see a better quality of life for them. That's very important. More than anything, is being able to have that good quality of life. So that's really good. I'm glad that you're actually doing that. So it's a question, given your background in gynecology, how do you view the impact of current cannabis legislation to women's health?
Well, it's poor, but research in women is poor across the board. NIH just instituted just a couple of years ago that any research going forward has to be, even if you deal with animals or rats, you have to have females in there, So research in general is behind. Cannabis is behind. We have mostly anecdotal stuff. The big things that are bothering women are menopause. Pretty much all we have are surveys about cannabis. Endometriosis, we're maybe a little step ahead, but we have surveys, but we have some animal research about showing that cannabis can definitely help endometriosis regress. So we're behind. There's not much out there.
There really isn't. And I just happened to see, I was on LinkedIn the other day, and there it's called Women in Cannabis is a group that I actually follow. And there was a young lady that was on there. They just did got their feedback and they gave for some stories.
Yes, dysmenorrhea.
Yes.
I would love to. I'm looking at that. I told them I want to get their data because I'd like to put together a case and get dysmenorrhea added to one of our upcoming conditions in Georgia. I would love to do that.
That would be good.
I was working with I forget, she's representative who's in South Georgia. She was really big on hemp and farming, but she just ran for the U.S. Senate, I believe, or U.S. Congress, but didn't make it.
Oh, that's Felicia.
Yes. She actually got the legislation and put in attorney language, legal language.
Yes,
but she gave it to me so that I can maybe share it with the next legislator who might be interested in tackling that problem.
That would be good, because I really do believe that we need more conditions on a registry. What we have right now is okay, but cannabis does have use in medicinal purposes for other conditions as well. And we really do need to stretch that registry, which is something that we'll be working on as well, trying to work with our legislators to make sure that we can get some other conditions there.
And I don't know if I would live to see it in Georgia, but I would love to see the law be like it is in California, where a physician who's knowledgeable about cannabis and the endocannabinoid system can make a recommendation for any condition that they feel it would help.
Yeah.
Versus you having these, a dozen or a couple of dozen conditions. That's where I would love for things to go that way.
That would be nice, because you have that relationship with your provider, and pretty much they know you, they know what you've been taking, they know all of your conditions. Mm-hmm. So I think that would be wonderful if they would do that as well. And so hopefully we could move toward something like that here, but we're a little bit slow here, but hopefully we can kind of move some things along. But I think having more information for our legislators, I think that would actually help. And I think also having the data and having things from the information that we can get based on what patients are using, how they're using it, and so forth. I think that would help to go along into to kind of move them in a different direction. So we can remain hope. Yeah. But the one final question I did want to ask of you is that do you have any final thoughts for our listeners?
Yes. I was noticing your cards there, encouraging people to get registered to vote. I believe if we want to move things forward in Georgia, that we have to elect different people who are more open to the plan and going to support the plan. That would be my prayer, is that we all get involved, all register and vote, and then keep the heat on these legislators to actually enact the will of the people.
Yeah,
that's what I want.
And you're not by yourself. I would love that. So this day based in this last election, the lack of voter turnout really was disheartening. And just to know that the number of people who didn't know the dates, which is why on my cards we put the dates out there, just so that people can see that. But also getting them to understand that these officials are elected by us and that they do work for us. And I think we get the more we get people to understand how it all works, that we can start making some changes, put some pressure to them to make the changes that we need, and actually listen to the people and do what we're asking them to do. How we want to medicate and what's best for us, and our providers know what's best for us as well. So for that, I'm looking forward to that as well. Thank you so much for joining us today. I really do appreciate you coming out for our compassionate action. So thank you all for joining us today. Stay tuned for more on Georgia Medical Cannabis Society.